Good evening and welcome to Doctors on Call. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth, and I'll be your host for our program tonight on infectious disease and immunizations. We will be glad to take your questions on flu shots, infections, and immunizations. The success of this program is very dependent on you, the viewer. Please call in your questions and we'll do our best to answer them. The telephone numbers for your questions can be found at the bottom of your screen. Our panelists this evening include Dr. Timothy Burke, an infectious disease specialist with Essentia Health, Dr. Ken Ripp, a family physician with the Rader Clinic in Cloquet, and Dr. Andrew Thompson, an infectious disease specialist with St. Luke's Infectious Disease Associates. Our medical students answering phones tonight are Samantha Harder from McGregor, Minnesota, Melody Shepard of Lake Benton, Minnesota, and Ryan Wilson of Wasilla, Alaska. And now on to tonight's program on infectious disease and immunizations. Well, Dr. Burke, this is flu season and everybody talks about the flu. What is the flu? Is it a virus, a bacteria? What is it?
Influenza is the full name of the flu, and it's a virus that attacks chiefly the breathing system, or it's a respiratory virus. It is seasonal in nature in the northern hemisphere. It tends to happen in the fall, winter, and spring, although there can be variations in those patterns, especially, for example, in 2009 when we had the most recent pandemic.
So, Dr. Ripp, there's flu immunizations for flu. I mean, who should get those and who shouldn't get them?
Well, the recommendations are that every person 6 months and beyond get a flu shot. Most people just require one shot and they're covered for the year. Some people might require two, especially young children. If it's their first year of immunization, require 2 flu shots within that season. And in general, they're very effective on helping keep people healthy.
Who are there people that shouldn't get a flu shot? Are there contraindications to them?
If you have a true egg allergy, which are really pretty rare, then those people should probably avoid a flu shot, but there are other options for those people. So most people can tolerate the flu shot.
Okay, thank you. Well, Dr. Thompson, is it, I'll come in to see you and I say I've got the flu and maybe I have influenza. Is that the kind of thing you give antibiotics for?
So as Dr. Burke said, influenza is a virus and antibiotics work only against bacteria. So there'd be no benefit to giving an antibiotic when you have the flu. And actually there are side effects to antibiotics, so you might suffer a side effect and be even sicker in the end.
Okay. Now, Dr. Burke, we have a question from a caller in Mountain Iron, wonders about flu shots, and if you're over 65, do you get a larger dose? And there's also this type that you can nasal inhale a flu shot. What's that all about?
The nasal vaccine, or flu mist, is approved only for healthy children and adults. So if you're over age 49, you're not a candidate for the intranasal, the squirt in the nose vaccine. In the last few years, the FDA has approved a high-dose flu vaccine for folks over age 65. And it has 3 times the amount of antigen, which is the thing that stimulates the immune system to protect you. And so that's what I would recommend for folks wanting to protect themselves against influenza who are 65 and over.
Dr. Ripp, a caller from Eveleth would like to know, how about if you've had Guillain-Barré? Should you get a flu shot?
That is a conversation you're going to want to have with your primary care doctor on the risks and benefits of the flu shot. That one, true Guillain-Barré is fairly rare, but it could be a contraindication to getting the flu shot. Depends a little bit on the circumstances of the Guillain-Barré.
Exactly. If I can jump in,
please.
It's if Guillain-Barré syndrome has been diagnosed within close proximity of previously receiving a flu shot.
Very good. Dr. Thompson, we've got a caller from Duluth who wants to, since we're on that topic of immunizations, are there immunizations for pneumonia?
There are.
And who should get those then?
There's older people should get a pneumonia vaccination over the age of 65, I believe. And also kids get a vaccination against pneumonia. And these vaccines don't work 100%. People have told me, well, I got the pneumonia shot, how could I have pneumonia again? But they do work against certain strains of pneumonia, and they may reduce the severity of your illness if you do get it. So they're definitely worth having.
And what kind of pneumonia do they prevent?
It's only a certain kind of bacteria, streptococcal pneumonia. There are different strains of that, and the vaccines try to target those. So it's possible to get a different type of bacterial pneumonia as well.
And the fact that they're there to tell you that the shot didn't work may have been that the shot kept them alive.
Exactly.
Good point.
Yeah, excellent. Yeah, great. Maybe we can move on here about vaccines. Here's a question, Dr. Burke. Do vaccines and other medicines cause tardive dyskinesia?
Not that I know of, no. Tardive dyskinesia is something that, this is reaching back to my general medicine
It's a harder
days,
one,
but
yeah. It's a hard question.
It is a problem that is associated with certain antipsychotic drugs, but vaccines, any of the common vaccines don't have that kind of neurologic side effect.
Dr. Ripp, here, one question I wanted to always know is how do you keep track of all these vaccinations? When a patient comes in, particularly children now get numerous vaccinations. I mean, how does it, what's the mechanics of keeping track of all that?
Well, each clinic has their own system, and statewide, I'm not sure how many years ago, but they started the Minnesota Immunization Registry, or MIC, and that's been really helpful in that as the clinics are more and more, and think almost all the clinics are now depositing all their vaccine information into a place that we can all draw from. Health professionals can go in and look up and see if someone's had a flu shot, a pneumonia shot, if their kids' immunizations are up to date. It is a little tricky because it is a data entry system, and so sometimes you have to wait a little bit for the data to get all there. But so each clinic will keep the child's immunizations records for quite some time, and then we have this registry to hope to look and see if the kid is up to date. And then the schools help us with tracking, and they will send parents notes saying, you know, Johnny needs this shot for this grade, and that also helps get the kids in and keep them caught up. It is a challenge, though. It is a real challenge. So,
I should add that Wisconsin also has a state immunization registries for our folks listening out there in Cheesehead land.
Where you live.
That's right.
So, okay, I call Dr. Thompson, a caller from Duluth, wonders, and this is we're going to get into this in another realm also, but a measles and mumps booster for a grandmother who has active grandchildren. Is that do these immunizations last forever? I guess would be one question.
Most immunizations don't last forever. Now, I would have to look up actually the recommendation on whether a grandmother should get an MMR booster because, like Dr. Ripp said, they're very complicated, and I can't keep straight all the ages at which people should get them off the top of my head. But vaccines do wane over time, and pertussis, for instance, is one that kids need multiple vaccinations for, and then sort of preteens need it, and then adults should get it as well. So we need repeated vaccines to kind of retrain your immune system, remind it that it should be aware of these invaders.
Speaking of pertussis, Dr. Burke, that's whooping cough. Do people still get that? I thought that was an old-fashioned disease.
Unfortunately, it's still still around, and you could say it's sort of a resurgence has happened. There are, we think, multiple factors. One is that the unvaccinated people can be sort of a susceptible reservoir for for pertussis and can spread it around among susceptible people. And another thing that we're learning is that the currently used pertussis vaccine is causes fewer side effects, but it looks like the protection is not as durable as the older, what was called the whole cell pertussis vaccine. And so right now we're in, I would say, a transition period. I think that the public health authorities are going to be changing the recommendations for pertussis vaccine, and are going to be there are going to be more doses of that vaccine in a standard vaccine schedule. For instance, over the, I think, 10 years or so, there's been a recommendation for the Tdap vaccine, which also has tetanus and diphtheria as well as pertussis, that all adults should get at least one of those, and that recommendation was especially strong for people working in healthcare because of this problem that pertussis is back, and it's a highly contagious bacterial disease, and it's sneaky because in the beginning of pertussis, the symptoms look just like the common cold. People don't really go to their physicians because we tell them not to go to the doctor for a cold. And so then in the second phase, when the cough gets going, that's when you can tell it's pertussis, and it's tricky that way.
Dr. Ripp, here's a question. Here's a quick one. If I call it from Duluth, can you get a flu shot and the pneumonia shot at the same time?
Yes, you can. Giving multiple vaccines at the same time is usually fine. If you're giving, there's a few Lyme vaccines that are a little different, that if your child's getting it, you want to give it a good, I say 8 weeks before you get another shot, 6 to 8 weeks, to let the immune system, as I say, run through its paces and be ready for another vaccine. But you can give multiple vaccines on the same visit, and they study that to make sure you're getting a good, as we say, immune system response to each at the same time. So, so if you have that captive audience, if you can give them the shots all at once,
right at the time.
Get it done.
All right, here's another one from Wisconsin. Dr. Thompson, do I need to get a flu shot to protect my elderly parents if they get the shot too?
Yes, you should. I think I mentioned earlier that vaccines aren't perfect. So in part, we rely on all the people around us to get vaccinated as well. Because if, say, your grandparents' immune system doesn't respond quite as well, it's really important that you don't then pass on the flu to them.
Oh, we have a lot of great questions here. Thank you for that. Was good. How about shingles shot? Does shingles shot cause shingles? Dr. Burt.
No, but I think there's
And how old do you have to be to get it?
They recently moved the recommended age, or the approved age, down to 50 years old. I think it started out at 60 or 65 originally when it was first on the market. Now it's down to my age,
Young.
I'm a candidate for the vaccine, and I'm going to talk to my internist about that when I see him in the fall.
Here's a question that I have, Dr. Ripp, and how do we keep all this vaccine stuff straight as physicians? I mean, everything's changing. There's many different vaccines.
Well, but before we started the show, we had talked about that infectious disease is one of the most dynamic fields of medicine in that there's new diseases all the time, and treatments change, and this bug becomes resistant. In the vaccine regime, in some ways, we are trying to keep ahead of the bugs with our vaccinations, because they are the most an effective way of preventing these diseases with vaccine. Every 6 months, there's a new guideline printed that tells us what people are recommended for what shots at what time. And so every 6 months, we get an update, and in between then, the CDC, the Centers for Disease Control will send us a little blurb saying, consider this, consider that, before the official recommendations come out. So there are a lot of smart people meeting regularly to keep up.
Sort that out.
Yep, sort that out.
Great. Dr. Thompson. Person again writes about the shingles vaccine. Now they had chicken pox. When should they get a shingles vaccine? Is it?
Yeah, so chickenpox and shingles are caused by the same virus. So if you had childhood chickenpox, your body was introduced to this varicella virus. But the issue becomes when you're older or sick at some point, the virus comes out and causes this very painful condition called shingles. So the vaccine is meant to reawaken your immune system, remind it that to keep this virus from coming back.
What if you've had shingles? Should you get a shingles vaccine?
I would still recommend it.
Still get it?
Yep.
Oh, okay. Very good. Now, here's an infectious disease question. So Dr. Burke, what if a caller from Chisholm wants to know what is Serratia marcescens?
Serratia marcescens is a bacteria, and it's in, when we talk about bacteria, the first sort of bin that we throw them in is gram-negative or gram-positive. It has to do with their staining characteristics, and that goes back to the dawn of bacteriology in the 19th century. But we still use it, and Serratia happens to be a gram-negative bacteria. Its environmental niche is water, so you know, standing water, sinks, showers, ponds. That's where it lives, and occasionally it'll cross over from that sort of environmental niche to cause human disease, such as commonly urinary tract infections, occasionally healthcare-associated pneumonia, and other types of infections, but those are the common ways it expresses itself.
Thank you. Dr. Ripp, a caller from Hibbing would like to know, he hasn't been sick since 1978. Good for him. I mean, I wish I could say that.
There you go.
And anyway, does he still need to get a flu shot? He's never sick.
You know, and the answer is still yes. You should get a flu shot. We like our vaccinations. You know, because the worst thing for him, someone as healthy as he is, if he gets the flu and ends up with a flu pneumonia, he gets debilitated, he's really going to set himself back. If you can have that flu shot as an insurance policy, and I'm a healthy person, but I get my flu shot every year, but it's also a way just to challenge your immune system a little bit and have it run through its paces on stimulating and making those antibodies and do all that, because we live in a relatively clean world and our immune system needs a good challenge. I think immunizations are a good way to keep it fit.
Revved up, huh?
Yep.
And I'd also add that very healthy people can still get very sick from influenza. And in 1918, some of the highest death rates were among young, healthy people. So just because you haven't been sick doesn't mean that you might not.
In our flu outbreak in 2009, it was the middle portion of the population that really suffered, and we all had patients who were in the prime of their lives who were debilitated and or, you know, led to their death. And so.
Thank you. Dr. Thompson, caller from Duluth, can you get shingles from touching someone who has shingles?
No, not really, because shingles is a reactivation of this virus that you've already been exposed to. So it's a virus that lives within your nerves, basically around the spinal cord. So typically shingles comes out of your own body. Now, if you had never had chickenpox and you touched someone with shingles, you could get chickenpox for the first time.
Thank you. Dr. Burke, a caller from Superior. You're getting the Superior questions tonight. I think that's the way it should be, don't you think? Anyway.
Yes.
These are two things that are very interesting. Is there a vaccine for Lyme disease and West Nile virus? Two common and concerning things. No.
The historical comment about there's for a few years in the 90s there was a Lyme vaccine on the market, but it was not very effective, and there were a lot of people who had musculoskeletal adverse effects from that. And so it wasn't very popular, and I think that led the manufacturer to stop making it and just got pulled off the market. It wasn't because of, you know, the FDA said this is a dangerous vaccine. and you must get rid of it. It's just it wasn't popular, and the business case, I guess, for it wasn't good.
Because we have a caller from Esco wonders, are they working on a new Lyme vaccine, or is that, have you heard anything about that?
Possibly, but no, there's nothing in the pipeline that's close to being able to give to patients that I'm aware of. How about you guys?
No. Yeah, I have the same experience with it was available, then not available, just because I don't think that it ever really, there's a few people who worked, a few loggers got it, foresters, but for the vast majority of people, you know, it made a lot more sense just to be cautious, do tick checks, wear the appropriate clothing, use DEET. So
we have about 5 minutes left. Here's a few questions. Dr. Ripp, is there a caller from McGregor wondering, are there a group of people that shouldn't get the shingles vaccine? I guess that's kind of a live vaccine.
Well, if you have some chronic immunosuppression, that's once again to be a conversation you want to have, the risks and benefits of the shot. And for the most part, you're really, the feeling with the shingles vaccine is you probably get 10 to 15 years of shingles protection. And so when do you want that protection? So yes, it is approved down to 50, but really, it's probably more beneficial to give it to you in your 60s, so you get that protection between your 60s and 75 to 80, because the chance of you getting it, the chance of you having a shingles outbreak each year you get older gets higher. And so you really need that protection in your retirement and beyond, as opposed to in that 50 to 60. Now, if you're 50 and 60, you have a lot of other medical issues where shingles would be devastating, then it might be worth getting.
Okay.
So once again, it's going to be a conversation with your primary care doctor, work out when's the best time to get that shot.
Thank you. Dr. Thompson, there's a caller from Hibbing wondering, after you get a cortisone shot, is there a period in which you have to wait to get a flu shot? Or if you're on cortisone, is there a problem getting a flu shot?
Typically, no. A lot of cortisone shots are given into a joint. That has very little systemic effect on people. And so I would say typically no. There may be some situations where you may wait, but talk to your doctor about it.
If I could add,
Please.
The flu vaccine in that kind of scenario would not cause harm.
Right.
It might not be as protective as if the patient hadn't had a cortisone shot, but it's not harmful. I think that's clear.
Thank you, Dr. Burke. We have a caller here. We just have a couple of minutes left. Clostridium difficile. This patient's had it and had a lot of relapses. That's a real hard management problem, isn't it?
Yes, it is. It's very difficult, and unfortunately, once you have one relapse, the odds of having additional relapses goes up substantially, and it's also the people who have the frequent relapses tend to be people who are older, more debilitated, more chronically ill, and it is a very difficult problem.
Okay, let's see. Dr. Ripp, do you need more than one pneumonia vaccine in your life? Is one good for long term?
Well, currently, if you're 65 and older and get a pneumonia shot, the current thinking is that you are good. If you've had one shot before 65, let's say if you've had lung problems or heart problems, you may have received a pneumonia shot early, and then you would get another shot at 65. And so they're not, so right now as it stands, it's one shot after 65. If you've had a shot before 65, you can get a second shot after 65. And I try and spread them out. So if you're 64 and get a shot because you had, emphysema or some other health issue that led up to a pneumonia shot, I tend to wait around 6 to 10 years to get the second shot. Because we know from the diabetics with the pneumonia shot is that it's about 6 years when the immunity response to pneumonia becomes to a very low level as far as measurement. Does it still protect you? Probably, but that's when the measurement levels get low. So about 6 to 10 years out, I'd consider revaccination.
Thank you. Dr. Thompson, this one we all hear. Why, when I get the flu shot, do I get sick?
Very good question. I've heard many people tell me, I don't want the flu shot because I'll get the flu. You aren't actually getting the flu. When you get a flu shot, you might feel a little achy, you have pain in your arm, you feel tired, you might even get a little temperature elevation, but that's a sign that your immune system is working. It's responding to the vaccine, and it's way better than actually getting the flu. So, get your shot.
Excellent.
And I would add this year,
Yes.
if you're afraid of needles, There's also a new type of flu shot that just goes, it's called intradermal. It doesn't even go through the full layer of your skin. It's a very tiny needle. So it's another option for people. The nasal spray and 2 different types of shots are available.
Great. Thank you. Boy, we had a lot of great questions here tonight, and certainly some we didn't get to. But I'd like to thank our panelists tonight, Dr. Timothy Burke, Dr. Ken Ripp, and Dr. Andrew Thompson, and our medical students, Samantha Harder, Melody Shepard, and Ryan Wilson. Next week, please join Dr. Ruth Westra for a program on diabetes, another popular topic, when her panelists will be Dr. Gail Baldwin, Dr. Deborah Ralston, and Dr. Stephen Teacup. Thank you for watching, and good night.